862 relating to reimbursement of healthcare costs in court emergency.
Recognize Senator Chris Telfer.
Thank you, Mr. President. You know, lately I'm getting an awful lot of emails and letters and phone calls from people who are hardworking Oregonians who are struggling to make their mortgage payments, put food on the table, pay their utility bills, put gas in their cars. And what they're asking me is, what about me? They're seeing federal stimulus packages, state stimulus packages, all this money going to help other people, but those that are hardworking people in Oregon don't seem to feel that they're getting any support from the state. Well, colleagues, Senate Bill 862 will do just that. It will empower local communities to increase access to health care services for low-income, uninsured workers. Specifically, it addresses a local community's ability to implement health improvement programs. These community-driven programs provide access to health care services through innovative and strategic partnerships and through modest contributions from the employer, employee, and the community. Last week, the day after the committee passed this bill out of committee, unanimously I might add, last week the Wall Street Journal published an article on the success of Galveston, Texas, where they developed a community health improvement program to provide health care to her low-income uninsured workers. The article states, quote, as the Obama administration wrestles with how to expand health care coverage to the millions of uninsured Americans, some local organizations are finding creative ways to help cover one of the most affected groups, employees of small businesses. And yesterday, I can't tell you how exciting this is. Yesterday, the federal government announced a new state grant program called State Access Program that includes support for community health improvement programs as outlined in Senate Bill 862. To get this money, states must have demonstrated that they have achieved statutory changes to implement the grant. Passage of this legislation would do that for Oregon and make us eligible to pursue this multi-million-dollar grant opportunity. The grants range from $2 million to $10 million per year for 5 years. There are grants available for 10 to 12 states. There are only 8 other states that currently have the statutory enabling power. Senate Bill 862 will do that for Oregon. Will hopefully attract up to $50 million to help our low-income workers get health insurance. So, colleagues, I urge you to join me in voting yes on Senate Bill 862, which will empower Oregon's local communities to provide their uninsured low-income workers with access to timely, quality, and affordable health care. Thank you.